Albuterol is a very high-yield topic. You can guarantee yourself that you will be asked a question about albuterol. Very high yield. You've got to know it. Two other very common brand names for albuterol include Ventolin and Proventil. Albuterol is a direct-acting, synthetic beta-2 agonist, which by far and away is mostly used for the dilation of bronchioles, and it's given via a metered dose inhaler, which is represented by this drawing on the right. Basically, you inhale as it sprays medicine, and thus delivers the medicine directly to the bronchioles where it can have its effect. The mechanism of action of albuterol is pretty straightforward. As already mentioned, it's a selective beta-2 agonist, mostly used in cases of asthma, but also for things like COPD or cystic fibrosis. As I mentioned in the previous slide, because it's taken oftentimes via an inhaler, it is delivered directly to the bronchioles, thus the effects are contained as much as possible. There's a little bit of spillage outside of the local area, but most of the effects, most of them are felt in the bronchioles where they reduce bronchospasm. And remember that the beta-2 receptor acts through the GS protein-coupled pathway. Most of the side effects can be described as an adrenergic overdose or an adrenergic response, basically from the systemic absorption of albuterol from the bronchial tissues, from the oral mucosa, anywhere where it touches really. So even though we're trying to keep the medicine localized to the bronchioles, there's always going to be a little bit of crossover into the systemic circulation. Most commonly, you're going to see 5 out of 5, most important one there, a tremor. Albuterol can cause a little bit of a tremor. Tachycardia, anxiety, and restlessness are also very common. And related to the tachycardia is this contraindication. You need to be careful about using albuterol with people who have coronary artery disease or that are prone to any kind of arrhythmias, especially tachyarrhythmias. We have called albuterol a beta-2 selective drug. However, there is a little bit of overlap or crossover onto beta-1. Very small, but still something to think about. Be very careful about who you give this drug to.